you, Scott. And as Scott mentions, this presentation is a little bit unusual because historically, aside from working on the obvious issue of preventing people from crashing their cars, health and healthcare impacts have not been a big focus of transport policy. And I think we need to change that. And so I'm going to here talk about, I think the impacts run both ways here, and I'm going to talk about both healthcare and health. And first I'll talk mostly about transport's impact on healthcare, and then about its impact on health. And the presentation is a bit of a brief catalog of new transport technologies that have come to my attention, but there's obviously many more in the pipeline. But I think the vehicles that can drive themselves are, of course, the transport innovation that everybody is talking about. And the implications are enormous for a number of sectors of the economy, including both health and healthcare. And starting with health, we know that about 90% of all vehicle crashes are due to human error. And just the fact that self-driving vehicles would never drink, would never get distracted, and would never fall asleep should all by itself offer an enormous gain in safety. And if the vehicles were also connected to each other so that they could be aware of each other's presence even when they were visually hidden, such as behind blind curves or on hills, then that would further enhance safety. So we're anticipating that self-driving cars would offer a huge benefit in terms of reduction in crashes. But beyond that, there's another healthcare implication as well, which is that self-driving vehicles would facilitate what is in effect a fully automated taxi service. Just hail the vehicle with your smartphone and one could drive itself to you in minutes. And since there's no cost of a driver, it could be cheaper, much cheaper actually, than today's taxis. So once this service becomes widely available, it may be that we think that many people will give up owning their own vehicle and instead use these automated taxi services. So we would then have a transport system where people who do not have their own vehicle or who cannot drive could enjoy the same level of mobility as people who drive their own car today. And this has some significant implications for healthcare. The New Zealand Health Survey in 2015 and 16 found that there were 119,000 adults, or about 3.2% of the adult population, and about 25,000 children who had an unmet need for GP services in the past 12 months simply due to lack of transport. It also found that there were 50,000 adults and 12,000 children who had an unmet need for after-hours healthcare services in the past 12 months due to lack of transport. So I think here we have an answer to that problem. So how long is this going to take for us to get self-driving cars? Well, this is very hard to say. There's a number of big companies working on this problem, and they're spending big money to deal with it. So you have to assume that they wouldn't be doing this unless they think the prospects are good and that it's going to happen pretty soon. But it will probably come gradually. Today there's high-end vehicle manufacturers that already offer various automated driving features, such as vehicles that can parallel park or that can automatically brake when a vehicle ahead of them stops suddenly. Unfortunately, to get the greatest benefits, including the automated taxis that I just mentioned, we need full automation. That is, vehicles where there's no need for anyone in the vehicle to be able to drive or even to be able to drive. Estimates of when this will happen, I've seen, range from anywhere from 5 years to 50 years. So it's really hard to say. It's a hard problem. I'll give you one example. If there's someone standing next to the road waving their hands, would you interpret that as somebody who's crazy, somebody who's a hitchhiker, or somebody who's trying to warn you of a hazard up ahead? That's a tough call even for a human driver, and obviously a automatically driven car is going to have to be able to deal with that as well. So I noticed that on Anne Marie's height curve, we had the self-driving vehicles was almost at the very peak, and that put it at 10 years, and that would be kind of my impression too. I would say that fully automated self-driving vehicles on public streets are probably 10 to 20 years away, but that's just my view, and I'm often wrong. But automation isn't just limited to cars. It's going to impact on public transport as well. And today we already have driverless metro trains in a number of cities around the world. And buses can also be automated. And without the cost of a driver, it would become economic to run small buses for a number of different specialized services. This illustration shows a 15-passenger self-driving vehicle from France that is now being demonstrated at the Christchurch Airport. It has no steering wheel. Private roads, such as those at airports, are ideal places to test driverless technology since the conditions can be much more carefully controlled than on a public road. But once these vehicles can run on public streets, these small buses could offer many additional services that would not be economic today. And one that obviously occurs to me is that many hospitals and clinics could run courtesy vans, kind of the way that that hotels run them at airports today, to bring them the patients to them. So that would be another great improvement in mobility, especially for people who don't have access to a vehicle. A related technology is delivery robots, and these are little vehicles that would travel at walking speed and use the footpath. And the one that's illustrated here is from a London-based startup company called Starship Technologies, but there's a number of others working on this idea. And right now, this particular one is semi-automated, since there's actually a human who's monitoring it at all times from a control center. Well, I don't know if I should mention pizza at a health symposium, but on Jeffrey Moore's curve that David talked about, I think the first movers, or the early adopters of this technology are actually likely to be pizza restaurants. But this technology could also be used to deliver all kinds of things, including hot meals and medications and other supplies for people who have trouble getting around. Before I go on, though, I should mention that this technology is proven to be a bit controversial. In the cities where it's been trialed or proposed to be trialed so far, there's been significant opposition from people who feel that such vehicles do not belong on the footpath. Whether this is a long-term problem or just an initial misunderstanding of the nature of these vehicles that will fade over time is something that remains to be seen, but that is a barrier. And then, of course, how can I talk about new transport technologies without mentioning flying drones? They've been proposed for delivering packages, most famously by Amazon, and also, once again, for delivering pizza. In fact, Domino's made the world's first commercial pizza delivery by flying drone last November right here in New Zealand. New Zealand's trying very hard to, and we're working on this at the Ministry of Transport, to make itself into a nice sandbox for people to demonstrate new transport technologies, including self-driving vehicles and drones. And along those same lines, Fastway Couriers, again here in New Zealand, made the world's first commercial courier delivery earlier. But getting closer to our interest here, I think once again we can think of many things that flying drones could deliver or could be used to deliver for people who have a hard time getting out and about. As this slide illustrates, the picture illustrates, they also have a potentially important role for disaster relief. Using human-piloted drones for disaster relief is an obvious application and one that's probably quite feasible today. However, there's still some barriers to the use of drones for more day-to-day delivery services. For that application, they would need to be self-piloting or almost self-piloting, and everyone's concerns about safety, privacy, and noise would need to be addressed. And that's still probably at least a few years away. Could drones also carry people? Well, at least eventually, I think the answer is yes. There's several companies working on the concept of people carrying drones. This particular one that's illustrated here is called Vahana, and it's being developed by Airbus. And this vehicle would be able to take off and land vertically from small sites, such as the roofs of buildings. But once in the air, it would convert into a fixed-wing aircraft for efficiency and speed. And I'll quote the Airbus website here about this because I thought it was pretty interesting. Vahana, it says, could be an air taxi, but it can also be used as a cargo delivery platform, an ambulance, for search and rescue, as a mobile hospital, as a limousine, or even as a tool to deploy modular infrastructure to disaster sites. So obviously Airbus is thinking about healthcare as being one of the early adopters of this concept. Here again, there's some significant barriers, however, before we see many of these aircraft. in order to offer low operating costs, low pollution, low greenhouse gas emissions, and low noise, and I think all of those would be needed for widespread acceptance, such aircraft would need to be electrically powered. However, my understanding is that today's battery technology would only allow these aircraft to stay in the air for a few minutes. So we will need significant improvements in the energy storage to weight ratio of batteries to make them feasible. Also, there are the obvious safety challenges of having lots of these aircraft flying over densely populated areas. So these barriers will take a while to overcome. Although I'm thinking that something like these aircraft, although perhaps not electrically powered or fully automated, could come sooner for rescue or medical transport applications similar to today's rescue helicopters. So those are some ways that emerging transport technology can impact on healthcare. So now I'm going to look at it from the other way and consider how emerging transport technology can impact on people's health. In my view, the transport impacts on people's health at least 4 ways. And most obviously, we have transport crashes and injuries, which we at the ministry spend much of our time trying to figure out how to reduce. Then there's also air pollution, which also gets some attention. But getting less attention are 2 others, diseases of inactivity and mental health. In the cases of diseases of inactivity, technology has, if anything, taken us in the wrong direction. The easier and more convenient it becomes to use powered transport, the less reason we have to walk, to bicycle, or to get around on our own power. And then there's mental health. If people are stuck at home and cannot get out and about, then they may become isolated and depressed. This chart shows the number of deaths in New Zealand from each of these causes according to the Global Health Exchange database. As you can see, diseases of inactivity and mental health actually cause more deaths than transport injuries, and I'm probably being conservative. In particular, the figure for mental health includes only deaths from what they call self-harm, and the diseases of inactivity are just that. I always think of exercise. There's people in this room who obviously know a lot more about this than I do, but I think of exercise as kind of the miracle cure for a lot of different conditions, and I don't think that's quite reflected here. But anyway, now the more cynical of you may note that diseases of inactivity tend to be an affliction of the old, while transport crashes are, unfortunately, if anything, more an affliction of the young. To put these things on a more equal basis, here I compare the years of life lost to these 4 causes. And we still see that transport injuries and diseases of inactivity are in about the same in terms of the years of life lost. There's, of course, many ways to look at this comparison. I've also looked at years of living with disability and social costs, and all I can say is that all 4 of these are major impacts of transport on health, and that it's hard to say how they rank. Logically, we should be addressing all 4, so let's consider how technology might do that. I've already talked about self-driving vehicles and the safety improvements they potentially offer, so we can hopefully expect transport injuries to be dropping quite dramatically as those get adopted. I've also talked about mobility as a service and smaller buses and how they could go a long ways toward improving mental health by providing mobility to people who lack a vehicle or who cannot drive. Turning to air pollution, it's fortunate that many late model vehicles are already considerably cleaner than the older ones. Here, the emerging technology of electric vehicles can probably take us to the next level by eliminating toxic emissions from the vehicle entirely. Our government's keen to promote them, and the cost of batteries continues to drop, so these vehicles are becoming increasingly competitive and will become increasingly competitive over the next few years. But it's going to take a while before they make up a significant fraction of the vehicle fleet. The numbers that we have today are still very small. And turning to diseases of inactivity, as I mentioned earlier, here we seem to be moving in the wrong direction. This chart, for example, shows trends from our household travel survey about how teenagers aged 13 to 17 traveled to school over the past 25 years. And as you can see, we have the percentage of cycling to school has dropped from about 20% down to about 4% today, while those who are being driven to school has risen from about 20% to over 30%. And we in government should be thinking about what we can do about this. Unfortunately, it's a challenge that kind of falls into the cracks between at least three sectors of government: transport, health, and education. And it's not really obvious who owns this particular challenge. And I think this is a challenge where all three sectors need to be working together to do better, along with promoting walking and cycling more generally. I noticed David's last talk, he mentioned that 42% of people's health is a function of their behavioral choices, and I think this is one of the key ones. This is an area where many of the solutions are not high-tech. There are some high-tech solutions that have already been mentioned, the wearable gadgets and so forth that monitor your exercise. But I do want to mention a couple that out of the transport sector. One technology is e-bikes, and at first glance you might think of e-bikes as yet another move away from physical activity, but you do still have to pedal, and so I view e-bikes as potentially broadening the market for bicycling to people who would otherwise not ride a bicycle. And in that sense, they offer an opportunity for the transport system to address the problems of diseases of inactivity. And I'll just leave you with a pitch for my own favorite technology for addressing diseases of inactivity, which is bike sharing, which hasn't yet caught on in New Zealand, but definitely has in some European countries, especially Germany. This map shows all the places where you can the little red dots are all the places around Frankfurt where you can pick up or drop off a bike share bicycle. Almost anywhere you are in Frankfurt, there's a bike sharing station within a few hundred meters. And as you can see, there are so many of them in the inner city that they had to make a special inset map. They couldn't even show them all on this map. So how do they do that? Well, I think the key to having so many pickup and drop-off locations is that each station requires no infrastructure other than a sign. That's it. There's a sign, and sometimes there's a bike rack there. And so here's a photo of what they look like, and it's a typical bike sharing bike in Frankfurt. And to rent the bike, all you do is choose the one you want to rent, enter its numbers into an app on your phone, and the phone will give you a code that you then type into the touch screen on the bicycle, and then off you go. The modest hourly fee gets automatically charged to your credit card. So I call that cool and simple technology. So where does this leave us? Well, I think what we've seen here, emerging technology, transport technology, will offer greatly improved mobility, especially for those who today find their ability to travel limited by lack of a vehicle or an inability to drive. And I think this greatly improved mobility will bring healthcare closer to home. But at least as important are the opportunities that emerging transport technology offers to improve everyone's physical and mental health through greater safety, new opportunities for physical activity, cleaner air, and more opportunities for social interaction. And we also, to do all that, we need to be considering the health impacts of our transport policy. And we in transport need to be working together with the health and the education sectors to promote the right technologies and the right behaviors. So thank you.